what I want to do is expand on what Jackie said a little bit, because this is the first time that all of us have kind of got together in the research area. It's really nice to see people that I've talked to and be a part of it. So what I want to do is just start off and go like this for a second. We're all here and we're going to learn something new. We all have different opinions and things like that, just exactly what Jackie said. And the way that I look at that is, if I could go around the room right now and ask everybody in here, what makes up a good rope to you? Some of you would say the length, the strength, the material, everything like that. To me, in the world that I live in, which is very simplex, what makes up a good rope to me is if it has 2 ends in the middle, I think it's a pretty darn good rope. That's as complex as my mind ever gets. 2 ends in the middle, I got a good rope. But what happens if I could take that idea of a rope of 2 ends in the middle and I could put it into my hand like this, and I have my 2 ends in my middle? What happens if I could reach into my hand like that and I could make that rope have 3 ends in the middle? So I've just taken my little rope with 2 ends in the middle and I've changed it. Now it has 3 ends in the middle. What happens if I could even go one step further, reach into my hand like this, and make a rope have 4 ends and no middle? Can you imagine the things that I could do with a rope with 4 ends and no middle? I could tie 4 things up at one time. So I've taken that, but what I really like to do is I like to take my rope with 2 ends in the middle like this and tie it in a knot like that and toss it up, and when it would come down, it would actually tie itself in 5 knots. So if you wanted to, this would be a really good time to clap. Perfect. Okay, so with that, I just wanted to get us going a little bit, to be thinking about that. Now I have to introduce you to my family that means the world to me. So if I look over here and I see this is Freckle, and me and Freckle are out for our walk. If I put the leash on Freckle, she will not walk. She will do the basset paralyzation, and she will just sit down and stick. If I take the leash off and drag it, Freckle will go on her walk. So that is Freckle. And then we go to the next one. This is a pug that I adopted. This is Pickle the pug, and I adopted him out of a shelter, and so he is one of my newest family members. This one is a 16-year-old pug, and his name is Tug Pug, and he is deaf and old and never had a home, but he has a home now. And so he lives with me. And then this is the newest addition. Why, I say again, why a 66-year-old man thought he needed a 12-week-old basset puppy is beyond me, right? And so we were out in the backyard before I came here. I got out of my chair, and Rue actually jumped right up into my chair and took it, and he is so proud. So that is my family, so keep that in mind as we go. So here we go. This little guy right here had a PAP of 113. So what I wanted to do really quick is just go over the physiology that we kind of did yesterday when we did the demo. Remember, this goes all the way back to 1913 and beyond, where people started looking at this problem and going, why are these animals coming to Hesperus, Colorado, and falling over dead? Why in Leadville at 10,000 feet are my native cattle doing well here, but when I bring in cattle from a distance, that they're falling over dead? So going clear back in there, this is the first animal I looked at in 1913. Not really, but that's how I feel. So just to review really quick, and all this is going to go really quick because I want to just cover some things. When you look at pulmonary hypertension, that's what we're talking about, right? Because pulmonary hypertension leads to cardiac failure. When I look at that and you look at the human literature, there are 5 types of pulmonary hypertension. The big one that we're going to look at is group 3. Meaning, group 3 pulmonary hypertension, if there is a problem with the lungs, and usually it's chronic hypoxia. Remember, let me define that word hypoxia because I'm going to use it. Hypoxia means that your body is not getting enough oxygen. There are numerous reasons for that, right? If I go and hold your nose and mouth shut, you're going to become hypoxic, right? So that's what, when I say that word, just keep thinking, that's because I don't have enough oxygen, and what is going to happen to my body when that takes place? And that's what we have over here in the group 3 session, right there. We are going to be hypoxic, and the most common reason for that is altitude. So here is something that I just want to share with you, because this is when you go back to human literature. If you go in and you Google, or whatever you do, hypoxia in the human, or you Google anything like that, the big fad today is this whole thing called sleep apnea. Because when you think about it, it even goes clear back to infant death. Sleep apnea is where you go to sleep and you don't breathe, right? You go into this sleep, REM, whatever, you don't breathe. A couple things in life that I don't like to do, right? One is I do not like to sleep. And I don't know why, I just never have liked to sleep, because when I sleep, I feel like I'm missing something exciting. So I just choose not to do it unless I fall over, then I might fall over today. But I just go. So one day I'm driving down the road, and it had been kind of a long trip, and I decided that I'm a little drowsy today, so maybe I have sleep apnea. So I decided I want to go in and get checked for it, just to be sure. So I go in, and they hook you up. How many of you have ever had a sleep test? It's so cool, right? They hook you up to all these things like that, and I remember her working on me for like 20 minutes to hook up, and she said, ring this bell if you have a problem, but you go to sleep now. And I'm going, okay, I'm sick like that. Moral of the story, at the end of that day, I had sleep apnea, right? And they said, yep, you need to wear one of these little things that this little man is wearing right here to take care of your problem. See it? See how comfortable he is laying there like this? He is laying and he's resting well. I can tell you, though, in all the medical stuff I get to deal with, this little thing right here 100% cured my sleep apnea. It did. It's like a miracle thing, because you put this on, and about the time you fall asleep, it goes, or it poof, blows you in the face. And so the nice thing about that is when you're wearing that, you do not sleep. If you do not sleep, you do not have sleep apnea. Does that make sense? So it totally cured me of the whole thing. But why do I bring up sleep apnea? Because it's a hypoxic state, right? So if we go to this one, this is the side that I want to spend the time on. Because here's what you have to think of. When you're raising an animal, you're doing a pap test, you're doing whatever you're going to do to that to try to stop this cardiac death or this whole pulmonary hypertension. I want you to look right up here at alveolar hypoxia. Okay, alveolar means lung tissue, right there. Alveolar hypoxia, meaning that the tissue in the lung is becoming hypoxic. Why is it becoming hypoxic? The etiologies or the reasons for that go on and on and on. The one we're talking about today is altitude. Okay, but remember, if they have pneumonia, if they have AIP, if they are all the different reasons, that's what we're looking at. Anything that starves the lungs from oxygen is what's going to initiate this thing. What we're going to do is we're going to go through this, so we're going to have sleep apnea, we're going to have whatever it takes to make you hypoxic, because the next thing that's going to happen when you have alveolar hypoxia, this is what happens. So picture this, and I did this for some of you yesterday. You have vessels in your lungs that are sitting like this, right? When you come up here, Kentucky, thank you to my friends from Kentucky coming up. When you come up to this elevation, your lungs are going to pick up, I am hypoxic, right? You, in this elevation, you become hypoxic. We are sitting there today doing this. So when you become that, your lungs become hypoxic, your blood vessels are going to shrink, right? Here's us. Whoop, wonk, wonk, wonk. They shrink, they almost pump, because when we breathe in, we have more oxygen in the top of our lungs than we do in the bottom of them. So our body goes, why are we going to push blood through the bottom of our lungs when the oxygen's at the top? So we are going to shunt. This is called shunting. We're going to push blood from the bottom to the top where it can become more oxygenated or get more oxygen. So we do this. Humans, wonk, 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 wonk. Alpaca, wonk, 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 wonk. Okay, yak, brr, brr. All of them do this with very elastic tissue, right? Here is bovine. Wonk, down to nothing. So we call that hyper-responsive. They don't have the elastic shunting, right? It all squeezes down and then it doesn't reverse. The problem with it is that is the heritable condition in cattle, how fast they will do that. We call it hyper-responsive. We are looking with the pap test, the blood test, whatever we can, that we're here to meet and decide what we're going to do and try to advance, is we're going to try to predict those animals that do this walk shunting very out of control. That's what cattle do. So if we look up here, that's what this is. They're going to go into vasoconstricting and then the remodeling. Remember, the humans don't remodel. They bounce back, bounce back, bounce back. The cattle do not bounce back. Boom! They stick, and then the vessel starts to squeeze down, which I'll show you pictures of. The problem with it is, when they do remodel like that, remember, and I'm going to make this up, and I always tell you if I make stuff up, if I remember to. So from today on, the heart is going to pump 1 gallon of blood up into the lungs. Boom, pushes 1 gallon of blood up into the lungs. What happens if we go through remodeling, the blood vessels in the lungs shrink down like this, all of a sudden that 1 gallon of blood cannot fit, right? Does that make sense? We've shunted down. We cannot get the 1 gallon of blood into the lungs, so consequently, the heart tries to push harder. It knows it has to get blood into the lungs to get oxygen, so it goes through this muscle thickening called pulmonary hypertrophy. The muscle's got to get thicker and thicker, and if that 1 gallon of blood can't get into the lungs, hence we have pulmonary hypertension. And that heart is going to work and work and work to try to overcome that until finally it goes into right ventricular dilation and death. So you have to remember that this part right here is where the genetic influence is to cause this whole problem. Hopefully that's making sense, and we can go into more detail in the questions. Here is an example, and I'm going to come and show you. So remember, who saw the pap test yesterday? Right? We stick that catheter down. Beautiful. We stick that catheter down. Here's a pap of 40. That's the vessel on its side, so that's the lumen where the blood goes. Look at a pap of 80. Can you see this? Wonk! You can now see right there how thick that vessel has gotten. So if we go on this side, same thing. These are normal, right there, and those are ones with an elevated pap. And if we look at this one, this is what on it. This is, see all the white fuzz? Shake your head if you can see the white fuzz right here. All that is capillary network in the lungs. That's the vessels that are normal. When we start shunting down, walk like that, this is what that looks like. So when you get to that, there's nowhere for the blood to go, right? So it starts to back up into the right ventricle, and they go into the congestive heart failure. I know this is a quick trip through physiology. So when you start to see these creatures, what happens, this is an example of what all the things they have. Look at this little guy's jugular vein right here. It's extended. This little guy has congestive heart failure. Why? Because the vessels have all shunted down. He's a genetic carrier. He actually got the disease, and he's going to die. And he did, but I saved his heart. So this is an example of how devastating this can be. If you get genetic carriers of this is a herd of 435 calves. 117 of them died before the age of 6 months of age. They died of congestive heart failure. They were free of pneumonia, free of all the environmental causes, and simply died. And when I look back, all of the dead calves came out of 2 sire groups. Okay? Bovine hyperreactor. These are just the animals that are moderate reactors and, of course, low reactors. I put yak on there because yak do the opposite thing. As they actually go up in altitude, yak's pap come down because their lungs become more elastic, more dilatory, and they are actually survivalists. So the yak is probably the one, and alpaca. They do the exact same thing. So that's just a girl that has the brisket edema. Remember, I said yesterday the pressure gets so high, it blows the fluid out of the vessels, and it sinks into the bottom of the chest like that. So here's some hearts. I put this on here for our friends from Kentucky. Here is a normal heart right here, and this is a grade 4 heart. What does this grade thing mean? We wanted to be able to track how much of this is actually happening in the feedlot at lower elevation, because it used to be when I started this many, many years ago and started having fun with it, I never saw high altitude disease below 6,400 feet. I moved to a place that was at 7,800 feet so I could do research and play with this disease. When I use the word research, that's probably a little harsh. I would say where I moved where I could play with the animals, right? So I spent much time petting them instead of researching them. But this is a heart that's blown out. See that little black hole right there? And I'll show you over here. This is a normal heart right here. And see that little black hole? This is a grade 4. That heart right there is about to blow an aneurysm. The pressure is so high in this animal, that is going to blow. If this animal doesn't die of brisket disease, it's going to fall over because of a pulmonary aneurysm from high pressure. And so when we look at this, this is grade 5s. This is total cardiac collapse. This is at the very end of that chart. The heart has absolutely zero function at that point in time. If you're a human and your heart looks like that, you have to go on a heart transplant program. You have to go on an artificial heart. Your heart has no function. This is what's happening to the cattle as we go across. How heritable is it? It's very heritable. I'm not going to even use that word like I know what it means. I'm going to let the geneticists talk about heritability. But remember, I track sires with the PAP, right? That's what I do. I go and stick them. I look and say, wow, this sire group has all this potential for a high PAP, and therefore I'm going to draw the conclusion that that sire may not be good for use in altitude. That's how I utilize the PAP test with this. If we just look at some of the hearts, these are just all the way from normal on here, normal, 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 and they're all cut at the same level of the heart, and you can just see what happens when the pressure rises. This is normal. When I cut them, this is a heart that has high altitude disease. That is non-functional. And we'll give statistics when Scott is up here about what we're finding as far as that goes. So I started doing this PAP test. Since all of you got to see the demo, I'm not going to go into that. How much is the PAP test doing? It started clear back in 1980. Right now that figure is wrong. We're at 498,000 head. But I've put it to the test, and I've tested at temperatures of 115 degrees and clear down to minus 42 to see if environmental changes could affect that. And really there are some effect, but for the most part, it doesn't affect it, which is really cool. I mean, the cattle are an amazing creature. So I think that's where I want to stop so we can get changed over. I can't wait to sit up here in the chair and look important. And hopefully that was some help to understand what shunting is. Thank you, guys.